My name is Laura, and I'm going to be your nurse today.
Hi.
Hey, I'm going to wash my hands real quick and don some gloves. It's nice to meet you.
Nice to meet you.
Can I get you to state your name and date of birth?
Annie Dixon, 12/16/1989.
Great. Okay. Do you know where you're at?
Yes, Jefferson Regional Medical Center.
Okay. And do you know what year it is?
2016.
Great. Okay. Patient is awake, alert, and oriented ×3. Her affect is appropriate for the situation. Do you go by Annie or Miss Dixon?
Annie.
Okay. Annie, is it okay if I perform a head-to-toe assessment on you? It will take approximately 20 minutes. Should not take, maybe a little less, but it should not take more than 20 minutes. Is that okay?
Yes.
Okay, great. At this time, I would have taken her blood pressure, and I'll just pretend that I did. Your blood pressure was 120/80, your pulse 85, your temp 98.6 orally, and your pulse ox was 100, which is all correct. Okay. So I assessed your LOC sort of at the beginning, but your level of consciousness, and I'm going to inspect your skin bilaterally. The temperature is warm, and her hands and her feet are both warm. I don't see any obvious lesions. Her skin is pink. No cyanosis noted to the nail beds. Her capillary refill bilaterally is less than 3 seconds. No clubbing of the nail noted, which would be at an angle of greater than 160. She doesn't have any clubbing. They're nice and flat, smooth, no grooves. So that looks normal. And her capillary refill on her toes is less than 3 seconds as well. Okay, now your head. Just going to take a look at her head. To appearance is normocephalic. It's round. No throughout the hair. Her hair is blonde and it's dry. It's not too moist. It's not oily. She's well groomed. No parasites noted. No bald spots or anything. It's evenly distributed on the head. Her eyes lay at the top part of her face. Eyebrows, she's got eyebrows that are blonde and they're symmetrical and no patches on her eyebrows or anything. She doesn't have eyelashes missing. Her eyelashes are nice and long. Her eyes are green, rich blue. Her nose is midline on her face, and her mouth lays at the bottom third, and her lips are symmetrical. Her ears are symmetrical there, so just an overall appearance, everything looks normal. Her neck is symmetrical upon her body. She doesn't have a thyroid goiter or anything. Everything looks normal, okay? I'm going to palpate your carotid artery, which is sort of below the ear there. +2, the rate is regular. +2, and then I'm going to listen here. The bell of the stethoscope. Take a breath from me a little bit. Okay, and again. Okay. Her rate is, her carotid pulses are strong, equal with regular rhythm and without bruise. If a bruise is heard, that would sound sort of swishing, and it could indicate plaque in the arteries or a narrowing of the vessel. I did not hear any bruise in the place. That's great. Okay, now I'm going to palpate your neck to see if I can feel any of your lymph nodes. I should not be able to feel any of them. This is your occipital back here, sort of at the base of the skull, tonsillar, pre-auricular, post-auricular behind the ear, anterior cervical, posterior cervical, and those are a little bit deeper, and superficial cervical. I do not feel any of those. there's also submental and submandibular. Okay, so they are not purple, which is good. Okay, I'd already just sort of briefly looked at your eyes. Your eyes are, again, symmetrical. Her pupils, just show it straight ahead for me. Dim the light. Great. They react to light. Perfect. They're approximately 3 millimeters. They're round in shape, approximately 3 millimeters. Using this little instrument, the ophthalmoscope, this allows you to see inside the eye. You see some important structures of the eye, such as the ocular fundus. This one does not work, but I'll just pretend that it does. And you just can see some of the inside structures of the eye, such as some of the vessels and the ocular fundus. I look for a red reflex, which would show up there. I'll just pretend that it does. Okay. And with the ears, I would take an otoscope, and I would use a pen light to look for any obvious. I don't see any parasites or any cinnamon or earwax on the outside, build up on the outside. They're patent. Have you had any trouble hearing lately or anything? And when I'm using the otoscope, I would take the pen up and back from an adult, and I would look in here and see if I see a shiny gray tympanic membrane, which I do. And that's what you want to look for, is for the tympanic membrane. Make sure it's gray and shiny, not red or any bubbling noted. She does have piercings bilaterally, piercing here and then one on her cartilage up here. But her ears are without lesions, immediate recoil, no tenderness. Do you have any tenderness when I palpate them? Okay, over the auricle, the tragus are nicely processed.
Yep.
Great. Okay. And the nose again is midline on the face without deviation. Do you have any trouble breathing?
No.
Okay. I'm just going to palpate any tenderness here on the sinuses. Okay. No tenderness on the frontal or maxillary sinuses. The lips are symmetrical again. They're pink, they're moist, without cracking or lesions. Okay. And now I'm going to look at your mouth. Okay, her tongue is nice and pink. And her buccal mucosa is nice and pink, no cyanosis noted. Her teeth are all intact, no broken or chipped teeth. And I'm going to use this just to see her. Perfect. Her uvula does vibrate there, and it's midline hanging there. Perfect. That's normal. The dorsal surface of her tongue, it is pink. A white coating present. Moist, wrapping a little from the cula, and the ventral surface is smooth and glistening, and the veins, a little bit of veins present there, and saliva is also present. Okay. That way. Okay, now we're going to move on to your thorax, the assessment of your thorax. Okay, I'm just going to palpate the thorax here with the palm of my hand. Any tenderness? Okay. The chest wall here is noted to be smooth, warm, dry. No lumps or lesions noted, or other skin or abnormalities noted. Her interior to posterior transverse diameter is 1 to 2, which is normal. Her spine here is a nice S shape and is midline, and I did not, any pain lump, palpated, okay. No lumps or pain noted upon palpation. Now, I'm going to assess, for tactile affirmatives. Okay, can I get your turn this? I'm gonna get this way, yeah, perfect. Would you put your arms to the left, perfect. Okay, can you repeat the phrase 919?
99.
Okay, great. No tactile affirmatives noted upon the palpation. Okay, and now I'm going to assess, do a deep breath for me. Great. The rise and fall of her chest was symmetrical. Inspiration was longer than the expiration, which is normal. Okay, now I'm going to also take some lung fields with the diaphragm of my stethoscope. Okay, you take some deep breaths for me. One. Okay. And I would be doing this on bear skin, but for the purpose, I'm just going to. Okay. Lung sounds are clear bilaterally in all fields. No adventitious breath sounds were noted. The vesicular sounds are present in the peripheral lung fields, which was normal. Okay, and now I'm going to approach just in two fields here. Here. And here. Okay. The sound is low pitched and hollow, which is normal. So now when I be on there. Okay. Now I'm going to inspect your or assess your cardiovascular. Okay. No pulsations, lifts or heaves visible over the pericardium. Okay. Some landmarks, some very important landmarks. We've got the left sternal border, the right sternal border, and the mid-clavicular line. Okay. I'm going to start with the diaphragm of my stethoscope. Okay. This is the aortic, which is the right second intercostal space, right sternal border. The pulmonic, which is the second intercostal space, left sternal border. Erb's point, which is the third intercostal space, left sternal border. Tricuspid, which is the fifth intercostal space, left sternal border. Mitral, which is the point of maximum impulse, and at this point we will listen for a minute. This is the fifth intercostal space, mid-clavicular line. And I would palpate that place too to make sure that to see if I actually feel it pulsate. Okay. Your rhythm is regular with no extra heart sounds or murmurs noted. Not always, but typically the S2 is more accentuated in the aortic and pulmonic valves, and the S1 is more accentuated in the tricuspid and mitral valves. S1 should equal S2 valves. Okay, and now I'm going to inspect your that's okay. Now I'm going to assess your peripheral vascular system. I'm going to check all the pulses. This is radial here. I'm going to go bilaterally. 2 plus, brachial. It already says the carotid up here. Here's femoral, here. Popliteal, dorsalis pedis, and the posterior tibial. Okay. We're all 2 plus on a 0 to 4 scale. 2 plus is normal. Okay. Now I'm going to lower the bed.